Good day, everyone. It's Dr. Cheah here. I'm one of the co-directors here at Create Health. It is almost the end of September, and as we approach the end of Polycystic Ovarian Syndrome Awareness Month, I would like to follow up the previous video that has been done by our lovely Dr. Sugandha Kumar and our dietitian Janet Yong. Today I would like to interview my co-director, Dr. Haider Najjar, in regards to PCOS and a few other lifestyle issues and fertility issues that we'd like to talk about. As you're aware, there's a lot of misconception out there with commonly a woman that has had an ultrasound showing polyfollicular ovaries, thinking that they have PCOS. Can you just clarify a little bit in regards to what constitutes PCOS as opposed to just having polyfollicular ovaries on the ultrasound?
Polycystic ovarian syndrome is a common condition. The clinical manifestations of this condition can vary. There's quite a range of signs and symptoms. There are three main diagnostic criteria to fulfill the diagnosis of this condition. The first one is related to the menstrual behavior. So irregular menses, the periods are typically far apart. They can be up to 2 to 3 months apart, and in some cases women wouldn't have periods at all. The second part would be related to the skin and hair. So there will be abnormal hair growth or acne. The third criteria is related to the ultrasound examination. And the technical definition can vary, but approximately 12 to 15 small follicles in each ovary or in one ovary would be sufficient to fulfill the diagnosis. And for that, you would have to have 2 out of those 3 criteria.
Thank you for clarifying that. As you know, having the diagnosis of PCOS can come as a shock. Can you give us a brief overview as to what you would advise your patients in regards to their long-term health optimization and their fertility options?
The majority of patients with polycystic ovarian syndrome, and the vast majority, some changes in the lifestyle would be sufficient to manage this condition. For example, if there is excess weight, just weight loss alone will be sufficient to convert what we call anovulatory cycles into ovulation cycles, which basically means that the patient can overcome all of these symptoms of abnormal bleeding, skin and hair conditions, and even fertility. The second line of treatment would be medications, and that depends on the symptoms that the patient is suffering at the time. So if fertility is not desired and the issue is mostly with skin or hair symptoms and or with menstrual problems, something as simple as the contraceptive pill would be sufficient to control these symptoms. The other medication that is also wisely used with polycystic ovarian syndrome is the well-known diabetes medications, metformin or Diabex. And this medication, even though there is no diabetes with polycystic ovarian syndrome, but it helps the sugar metabolism, which as a result can help the ovulation. And this medication can be used with Clomid or without. And of course, Clomid is the medications of choice when women have difficulty conceiving due to polycystic ovaries, where it actually helps inducing ovulation. The most common fertility treatments and the first line of treatment after, of course, addressing lifestyle issues would be metformin and Clomid. There are other medications that can be used as well. Apart from medications, surgical procedures can be attempted laparoscopically. It's called laparoscopic ovarian drilling, where tiny little holes are made in the ovaries and they create or lead to a certain biochemical reaction that occurs under the surface of the ovary, which leads to ovulation naturally without medication, and that can succeed in around 50% of the time. And the other line of treatment, if all fails or unsuccessful, then you can attempt assisted reproductive technologies, namely intrauterine insemination or IVF.
Yes, I would like to reassure everyone that in the fertility world, PCOS is, like you said, mainly treated with options of ovulation induction, stepping up to IUI and stepping up to IVF. But know that most of our polycystic ovarian syndrome patients respond very well to these treatment options and eventually will have their babies. At Create Health, we would also like to reassure you that we have a team of healthcare experts here who are practicing holistic medicine that will help you through this journey, be it our team of dietitian, diabetic educators, specialist midwives. We also have a physiotherapist here that could help you optimize your diet and exercise. And of course, our team of doctors here are more than happy to help you.